First rib and second rib. From above, from below. The number 1 structure here is on the inner side. Number 1. Attachment of area covered by pleura. From below on inner side, area covered by pleura. Number 2 is costoclavicular ligament. Number 2, attachment of costoclavicular ligament. Number 3, intercostal muscles and membranes. Number 3, intercostal muscles and membranes. Number 4, lateral costotransverse ligament. Number 4, lateral costotransverse ligament. Number 5, levator costi. Levator costi. Number 6, scalenus anterior. Here is scalenus anterior. Number 7, scalenus medius. Number 7, scalenus medius. Number 8, scalenus posterior. Here is scalenus posterior. Number 9, serratus anterior. Number 9, serratus anterior. Number 10, serratus posterior superior. Serratus posterior superior. 11th, subclavius. 11th, subclavius muscle. 12th, superior costotransverse ligament. 12, superior costotransverse ligament. 13, suprapleural membrane. Here is attachment of suprapleural membrane. This is first rib and here is second rib. Attachments and the relations of the first rib. Anteriorly, the neck is related from medial to lateral side sympathetic chain, posterior intercostal vein, superior intercostal artery, and ventral ramus of the first thoracic nerve. Superiorly, the neck is related to deep cervical vessels and 8 cervical nerve. The anterior groove on the superior surface of the shaft lodges the subclavian vein. Here is anterior groove. Anterior groove on the superior surface of the shaft lodges the subclavian vein, and the posterior groove. Here is posterior groove. Posterior groove lodges the subclavian artery and the lower trunk of the brachial plexus. The structure attached to the upper surface of the shaft, the origin of the subclavius muscle at the anterior end. Origin of the subclavius muscle, the attachment of the costoclavicular ligament at the anterior end behind the subclavius. The insertion of the scalenus anterior on the scalene tubercle. Here is insertion of scalenus anterior on the scalene tubercle. The insertion of the scalenus medius on the elongated rough area behind the groove for the subclavian artery. Here is the groove for subclavian artery. Behind it, here is scalenus medius. The lower surface of the shaft is covered by costal pleura. The lower surface. This lower surface of the shaft is covered by costal pleura and is related near its outer border to the small first intercostal nerve, which is very small. Okay, outer border, first intercostal nerve. The outer border gives origin to external intercostal muscle. Okay, the outer border gives origin to external intercostal muscle and upper part of the first digitation of the serratus anterior, just behind the groove for the subclavian artery. The outer border gives origin to external intercostal muscle and upper part of the first digitation of the serratus anterior, just behind the groove for the subclavian artery. The thick portion of the outer border is covered by scalenus posterior. Here is the scalenus posterior. So the thick portion of the outer border is covered by scalenus posterior. The inner border gives attachment to the suprapleural membrane. Inner border gives attachment to suprapleural membrane. The tubercle gives attachment to the lateral costotransverse ligament. Lateral costotransverse ligament.